We want to bring in one of the people who have been leading the discussion now in our area and working to get out the latest information. This is Dr. David Kershke. He's the medical director at the Northeast Health Office for the Tennessee Department of Health. Dr. Kershke, thank you very much again for your time. We know you're incredibly busy. Thank you for being here. First off, you know me. I've got a bunch of questions. I want to know what is the most important thing that you want people to know based on the latest information you're seeing from the Northeast Regional Health Office.
Yeah, we really just continue to see an increase in cases, and you just talked about deaths. So really just to remind people, when you're practicing social distancing or thinking about the prevention measures, we really need to be vigilant about doing that to protect those people that are at highest risk for complications, like people that are older, people with pre-existing conditions. So the better we are at staying healthy ourselves, that's going to protect those other people that are at high risk for complications.
We had heard about a cluster of cases in Hawkins County earlier in the week, some of them involving healthcare workers, and we also want to respect the privacy and all the HIPAA laws that apply here. But what can you tell us about this latest death? We know that we've lost two fellow citizens here in the Northeast who were males, and one of them was in their 70s, one was in their 50s. What can you tell us about this most recent death?
Yeah, really just all of the deaths are in people that are high risk, so either older or have pre-existing conditions. So again, we just want to remind people, if you're not practicing social distancing or prevention measures for yourself, do it for those other people in our communities that are at high risk that could suffer complications or death from coronavirus.
Dr. Kershke, thank you. I'm sorry, are we seeing deaths that are people who remain critically ill for days, or is this like a sudden onset of symptoms? We're hearing in some parts of the country it's very rapid illness for some people. Can you give us some information about what you're seeing here locally?
Yeah, so I think the good news is that most people are recovering. So among people that are hospitalized, most of the people in our region have recovered and gotten out of the hospital. But again, we have seen deaths in people primarily that have pre-existing conditions or in the older population that we know is at highest risk.
Are we seeing these that are becoming critically ill, and even those who have died? Are these people who are contracting this through community spread at this point, or are these people who have traveled? Are we even still talking about that in terms of trying to track the history of the virus?
Yeah, we really have a mixture of, among our recent positive cases, there's a mixture of people that have traveled, people that are at contact to a known case, and then some people that just, there's no known contact or travel history. So they apparently have gotten the virus from just being in the community.
It's so good to hear that most are recovering and are on the road to recovery. But are you tonight monitoring cases here locally with people who are critically ill or severely, even hospitalized?
We do have cases that are hospitalized, no one that I'm aware of that's in critical condition currently.
3 deaths in a week is rough. It's rough. It seems very, very real now. What do people need to be preparing for? I know you're not in the business of having a crystal ball in public health, but help us maybe brace for what's to come.
Yeah, so we expect cases to increase over the next week or 2 or 3, maybe 4. So really now the next month is really kind of the test to see how well we're doing with our social distancing, with our public health measures, to really see if we flatten out the curve. So we will continue to see cases rise. We just hope they won't rise so fast that they overwhelm our healthcare system. So really just practicing those social distancing and prevention measures to help flatten the curve.
The health departments have stood up some new test sites this week, and we're hearing that there is an escalation of testing that's going on. Are you seeing an improvement in the test result time? We know that had been not what you wanted it to be. Is that getting any better?
There still is a lag in test result time. I would say the real reason for increasing testing is that because we don't have vaccine or medicines for coronavirus, our most important measures are isolation and quarantine. So if we can identify cases, get them into isolation, quarantine close contacts, that's the best way to reduce the number of people that positive person infects. So really to have an impact on coronavirus, which right now experts are saying that for every case there's 3 or more other people that they infect. We really have to get that number down to 1 or below 1 to have an impact on the outbreak. So really identifying those cases, making sure they stay in isolation, and then quarantining all their close contacts so that if they get sick, they're not out in public when they do that, is, along with social distancing, our most powerful public health tools that we have.
In the few minutes we have left with you, I want to get your take on a few things I think people are trying to make decisions about. Number one, we're seeing these homemade masks, cloth masks that are now being kind of normal. The CDC's recommending now, we're hearing that people should wear them when they go out in public. That's fairly new information just coming out. Your thoughts on who should be wearing masks when they go out in public?
Yeah, so we've heard the CDC talking about masks, and we saw in Los Angeles County recommending masks. So the thing to know about wearing a mask is the person that should wear a mask is someone that has coronavirus. Now we know that about 25% of people are asymptomatic when they have coronavirus, but can still spread it. So if people wear masks in public, that can help protect the person wearing the mask from spreading it to other people. So you may see recommendations coming out from CDC or Tennessee Department of Health in coming days or weeks about wearing masks. But again, the rationale for that is that if someone is asymptomatically infected with coronavirus, the mask helps prevent them from spreading it to other people. So the mask is really worn by the person that has coronavirus, whether they're symptomatic or asymptomatic.
We're hopefully going to be updating some news on that front for you. And thank you, Dr. Kirschke, for your input on that. I want to ask you real quickly, you know, the internet is full of things you should be doing right now, and many of them are maybe true. What about this thought that when you come into the house from being out in public in your essential travels, that you should be just pretty much taking your clothes and put them in the laundry, taking your shoes off, don't wear things in the house? For you as a public health official, is that internet myth, or is there some wisdom in that?
I mean, I think the most important thing is wash your hands. The other thing that I think about are something that we touch frequently are cell phones. So if you've been in public using your cell phone and touching things in public, you know, be careful about your cell phone, especially if you're eating. A lot of people eat and scan through their phone while they're eating. So you've washed your hands, now you're gonna sit down and eat, pick up your cell phone, start scrolling through it, and now you're kind of dirtying your hands again. So those are the kind of things I would think about mostly. Is the main thing are things we've talked about: wash your hands before you eat or touch your eyes, nose, or mouth.
30 seconds left. Are we in this for a few weeks, a few months? What are you bracing for?
Yeah, so we've also heard people talking about hopefully there'll be a seasonal aspect to coronavirus where it might wane in the warmer months. We can't plan for that, and we're not planning for that to be the case. It would be nice if that did happen. But we do expect over the next month for our cases to continue to increase in our region. But we need to kind of buckle down on all our prevention, social distancing, public health. We're doing contact tracing and quarantine, just all the prevention measures to try to flatten that curve so our healthcare system doesn't get overwhelmed like we're seeing in other places like New York.
Absolutely. Time to take action now. Dr. David Kirschke, literally on the front lines. Thank you for the work you're doing and the work of everybody at the Regional Health Office. We appreciate it.